Pathmonk is the AI for website conversions. With increasing online competition, over 98% of website visitors don't convert. The ability to successfully show your value proposition and support visitors in the buying journey separates you from the competition online. Pathmonk qualifies and converts leads on your website by figuring out where they are in the buying journey and influencing them in key decision moments with relevant micro experiences like case studies, intro videos, and much more. Stay relevant to your visitors and increase conversions by 50%. Add Pathmonk to your website in seconds, let the artificial intelligence do all the work, and increase conversions by 50% while you keep doing marketing as usual. Check us out on pathmonk.com. All right, everyone, welcome to today's episode of Pathmonk Presents. Let's talk about today's guest. Today, we're joined by Isaac Justesen. He's the CEO of Patient Partners. Isaac, welcome to the show.
Hey, thanks for having me, Rick.
Of course, of course. So, Isaac, I wanna just dive right in and talk about Patient Partners a little bit. If you can tell us, how it came about, why you founded the company, and what's the heart of what your company does. That would help us a lot.
So we are a full service marketing agency for physical therapy clinics. And we're working with clinics all across sort of North America, but we really help them with all of their marketing efforts.
Okay, sweet. Is there any specific problem? Some agencies specialize on SEO, PPC, or whatever it may be, right? Do you guys specialize in something specific, or do you take, the full gamut, let's say, of the marketing and then help them with that?
We do full service for a lot of these clinics, but that said, SEM, SEO and PPC are for a lot of clinics, that's one of the main things they focus on. So really the problem we solve for them comes down to we get them more new patients, more customers, and typically through digital marketing, but there's a little bit of community building and print marketing that's often involved in it as well. As a healthcare business, it's quite a trust-based, community-based type of service. So with that in mind, we often help clinics with some of their community building efforts.
Yeah, that makes a lot of sense. So in a physical therapy clinic, then who's the person that usually reaches out, to someone like you, Patient Partners, and say, guys, I think we need help with marketing?
Oftentimes, it's the clinic owner themselves because lots of these private practice clinics in particular are solopreneurs or they've got a small team. But for the slightly larger clinics, it's often a clinic director. So maybe the CEO of the clinic is, not quite as involved in the day-to-day at that point, and they'll have a clinic director below them that's in a leadership position, and they're the ones that are really boots on the ground in terms of the day-to-day operations of the clinic, and then by extension, the marketing of the clinic.
Got it. Okay. And do they have a specific goal in mind when they come to you, or they're more like willing to be guided, consulted on whatever issues they're facing when it comes to the marketing, acquisition, or anything like that? Is there something specific they come to you with, or how does it work?
Oftentimes they come to us saying, hey, how do I get found more on Google? Like, how do I
Hmm.
rank higher on Google for, my search terms? And they'll see their competitors up there in the map pack or in those top three positions. And they say, Isaac, hey, how do I get there? Other times they just say, look, man, I need more patients. Our team isn't busy enough. And to some extent, they almost don't care how we get them, whether it's SEO or PPC or email marketing or some other lead gen mechanism. To some extent, some of these clinic owners, they really don't care where the new patients are coming from, as long as they're getting enough new patients at a reasonable cost per acquisition, and they can still have an ROI on those marketing efforts.
Right. They just want more business, right? Doesn't matter how
You
it
got
comes,
it.
as long as it keeps flowing, right?
You got it.
Uh, yeah, it makes sense. Um, so so what's the role of your website then? Because as you know, as the audience knows, Pathmark is a website tool, right? So we were quite keen on understanding the dynamics of a website. especially with our guests, understanding, how important they think the website is, how it works. So, what's the role of your website when it comes to attracting new clients?
Our website's really, really important for that. And we get a lot of inbound clients through some of the content that we create or them just searching for a physiotherapy marketing agency. We specialize in SEO among, some of the other channels. So we've got a pretty good rank for our own website, which is great. But in terms of actually, when people do come across the site, then we need to convert them into leads or get them to book a call or request a free audit. And so the website is a really key part of sort of explaining what we do, why it matters, how we can help clinics. We've got some case studies and things like that, and then a couple of lead gen mechanisms between lead magnets, like an ebook download, or just a link to book a meeting or request a free audit. So it's really important for us. A good portion
Mm.
of our leads come through just inbound through the website.
Okay. But well, that shows that you guys know how to do your SEO and your PPC, right? Because at the end of the day, if they're coming through your website, they find you, then it means that you're doing something right on that end. So it's also, testimonial of how you work, I would say.
You
So,
got it. It's kind
right.
of, showing off. I mean, if we rank well for our key search terms, we can help you rank well for your key search terms is kind of a good way to think about it. And, if our website looks great, then, obviously we know how to build good looking websites. So it's kind of an advertisement for patient partners in and of itself.
Hmm. Makes sense. Yeah. And I'm curious on the other side of things then. Uh, Many of the owners and the CEOs and whatnot that are coming to you will have a website, right? So do you see any kind of patterns when it comes to their website? Do you think they have some specific strengths or maybe weaknesses or areas that could be improved when they come to you that you can spot and say, we can change this, and then you'll start getting more leads as ASAP?
Yeah, I mean, lots of these clinic websites are, to be frank, not very good. They're maybe put together by the clinic owner themselves who doesn't have a lot of, marketing or certainly web design experience. And so oftentimes it's really, basic things around web design and just having a clean, modern, good-looking website. But from the actual lead gen perspective, I think there's a lot of things that clinics and many local service businesses, for that matter, kind of miss. And for example, one of them is just making it really easy to convert. For a lot of local service businesses, it's you either want people to book an appointment online or you want them to call your business, call your clinic, or maybe fill out a contact form. But they don't make it really easy for people to do one of those actions. And so with
Mm.
just some very simple kind of conversion rate optimization tweaks of adding your calls to action in the hero of the page and in other sections of the website, we can make a pretty positive impact on the conversion rate of the website with just some pretty simple tweaks. And so that's one of the things that I see a lot of clinics get wrong.
Okay. Maybe we can dive just a little bit deeper on that because my next question was about your experience. You have a extensive experience as a marketer, and obviously, you have your marketing agency. You run one, so um, I want to understand a little bit about your perspective on what makes a great converting website, right? So, if there's anything you can share with our audience in terms of tools, I know I like to geek out on tech stack, right? Or tips or methods or anything like that you can recommend? Obviously, you just touched on it, the CTAs and whatnot, but do you have anything else or maybe a framework even that you can recommend?
So I think a couple of things come to mind for local service businesses in particular, and of course you want to talk about who you are, what you do, maybe why people should work with your clinic or your business as opposed to others, anything that makes you unique, but have your location and contact information really easily findable. Don't make people, website visitors, have to click around to try and figure out, okay, where exactly are they based? Is this going to work for me? Is this a convenient location for me? Make it really clear and really obvious. I think that's just a simple way. When you think about sort of the user experience of someone comes to your website, first they're going to want to say, okay, is this the right type of business that I need? But pretty quickly they're going to get to, okay, is this a convenient or is this the right sort of location for me? And is it on my way to work? Is it close to my house? And so they're going to want to understand, okay, where are you based? And so you're having your location and contact info really easily accessible, I think is a simple way for you to for any local service business to really sort of improve that website experience. And another thing that I'm seeing more and more, and I think is a really interesting tool right now, is chatbots getting a little bit more sophisticated. Something you can add to the website, AI-powered chatbots, where you can train it on your information. You can use different content on the website to train the AI, and then it's actually a somewhat sophisticated um, interaction with the bot, and then it can even pass it along to your sales team or your front desk team, or someone to pick up the phone and or respond to this person. So I think that's another really interesting tool that people should be looking into and taking advantage of.
Yeah, I like the difference between the two things you mentioned, right? It's so simple as putting a phone number and an address on it. Just keep your contact information clear, right? And then on the other side of it is, chatbots, have a little bit more sophisticated, but at the end of the day, the idea is to get more people in, get more bookings, specifically for these clinics. But yeah, that's very interesting. Sure.
Yeah, you're 100% right. It's, on the one side, it's not rocket science, it's just
Mhm.
really, simple things and trying to be empathetic to the user of, okay, this is what they want. And then on the other side, you've got some of that more, I mean, marketers, we all love tech and tools and things like that. So, on the other side, you got a little bit more of the sophisticated marketing tech.
Totally, totally. All right, Isaac, well, I'm curious, but I'm sure the audience is curious also. Um, so we switch gears just for a second and we talk about you as a leader, right? What do you do on a daily basis? How do you run your agency? What are the main tasks that you do each day so that we can get a glimpse into, a day in the life of Isaac?
Well, as the agency has grown and our team has grown, I'm a little bit less on the operations side, the implementation side, I should say. And so I'm not doing quite as much of the SEO work and the ad work, but now I'm doing more of the project management, lots of account management as well, chatting with clinic owners and building relationships. I think relationship building is such an important part of, I mean, for marketing agencies, but really for any business. A lot of it just boils down to relationships with your customers, with your team, with suppliers. And so a good portion of my time is spent on relationship building. And
Mm,
then of course there's a little bit of marketing the business as well. And so my day-to-day is changing, and I think it's going to continue to change as the business grows even further and the team grows even further. But it's an exciting time. So yeah.
mm. All right, glad to hear. I like that, you're keeping that FaceTime because obviously you need to, but you don't shy away from getting your hands dirty, getting back into doing some marketing, right? So yeah, that's
100%. And, I
yeah,
never want to fully remove myself from the actual marketing work because, well,
no,
A, I
that's
like
good.
it, but B, it's how I keep my finger on the pulse of what's going on, what are the new tools out there, what's going on in the industry. And so, I think if I were to completely remove myself from all of the marketing work, then I might sort of lose my edge a little bit, so to speak. And so keeping a little bit of that on my plate, I think, is a worthwhile use of time.
Yeah, yeah, wise words. Okay, so we're about to wrap things up here. I want to jump into our last segment. We have a rapid fire question segment that I really enjoy because it's fast paced, it's quick. So we usually, just do one question and then a short and crisp answer. Are you ready for that?
I'm ready.
Sweet. All right. What's the last book you read and why did it stick with you?
Last book I read was Do Hard Things. I've actually got it over here by Steve Magnus, and great book. It's all about sort of toughness and resilience and what we kind of get wrong with that. And I think it's a useful book for, I mean, any business owner, but not just business owners, anyone who's got sort of a goal that they're working towards. That could be life or fitness or business, really anything. And just it reframes a little bit what it means to kind of have some grit and determination in the pursuit of your goals, which is a great book.
I love it. I follow Steve on X and he's got some interesting tweets out as well. So yeah, I like that recommendation. Cool. So if there are no boundaries in technology, what's one thing that you would want to have fixed for your role as a CEO today?
If I could somehow get a list of everyone who is in market right now, every clinic owner who's looking for an agency or a website, or you could imagine this for just about any type of business. Now, if you could see over at Pathmark, everyone who's looking for this type of tech right now, I mean, I would pay good money for that kind of technology, but I don't know if such a thing exactly exists just yet.
Well, if it does, you'll have your inbox full by the end of this. So,
Yeah, right.
all right. So automation, right? If there's one task that you do every day that you could automate, it doesn't have to be work related, but obviously you're welcome to include that. What would that be?
Maybe I should change my previous answer that I just want a tech that will automate every monotonous piece of task that I have. I can just ask it to automate. But no, I think the if I could automate anything, and I'm a big fan of automation in general, it would probably be around some of the project management, translating client notes and action items into tasks for the team. Um, that would save me a ton of time, and it's not the most interesting work in my opinion. And so I would love it if I could automate all of that.
Okay, good one. Um, so if you could go back in time and give yourself a piece of advice, if you were to restart your career as a marketer first and then, becoming a founder and a CEO, what advice would you give yourself?
I think the advice I would give is to learn a broad amount about marketing, but then specialize in a particular area. I've heard it referred to as sort of T skill, where you have this broad depth of knowledge across marketing, so you can speak with different departments and different stakeholders. You can speak to SEO, you can speak to social and email and etc. But then you kind of go deep on a particular could be a particular topic, a particular channel, and so you'll gain some really deep expertise in a particular area, but then you still have that breadth of knowledge as well to speak to and think about how your area maybe interacts with other areas of marketing or of the business as well. And I think that's just a really valuable skill set for any marketer to have.
Totally, yeah. That T shape is something I actually we brought up in our last interview with the last guest. So it's funny you bring it up. It's interesting. It's a really good concept. You have that broader knowledge, the horizontal side, and then you got your specialty, right? So and you can apply it to many different things. So
100%. You could absolutely
yeah.
apply it across, yeah, work, life, any number of areas.
Very true. Very true. Well, Isaac, want to personally thank you for being on the show with us today, and I want to give you the last word. So, if someone forgets everything about what we talked about today, about the whole interview, what's one thing that they should remember about the work you guys are doing at Patient Partners?
If you're a clinic owner and you want to grow your business and get more new patients, hit us up.
Too easy. All right. To go to patientpartners.co then, and that, they'll help you out.
You got it.
Perfect. All right. Thanks again, Isaac. Hope to see you again soon on the show.
Appreciate it, Rick. Thanks for your time today.
Of course.